Good morning, everyone. We welcome all of you who have tuned into this webinar on reopening houses of worship, the intersection between religious liberties and congregational safety. I am Thomas J. Bickerton, the resident bishop of the New York Annual Conference of the United Methodist Church. I'm the spiritual leader of 421 congregations that extend from the tip of Long Island to Staten Island, Manhattan, Westchester, and well into the Catskill-Hudson Mountain region. I'm blessed to have congregations that serve urban, suburban, and rural communities of diverse populations in this region. We are also blessed today to have this morning with us Mr. Joel Cohen, Senior Counsel for the law firm of Strzok and Lavin. Welcome, Mr. Cohen. And I still think we are waiting for Dr. Jay Varma, is that correct? Who we hope will join us, who is the Senior Advisor for Public Health for the Office of the Mayor of New York City. In addition, I want to thank the team that has worked to put this event together, who are also participants in this webinar. Reverend Peter Cook, the Executive Director of the New York State Council of Churches, the Reverend Dr. Q. English, who is the pastor of the Bronx Christian Fellowship Church, Peter Goditis, who is the Executive Director of New York Disaster Interfaith Services, and Rabbi Joseph Potasnik, Executive Vice President of the New York Board of Rabbis. Welcome, one and all. The constant challenge in our lives during both good times and chaotic times is to connect what we believe with how we live or how we act out our faith. It's one thing to stand in a house of worship and recite a creed or a long-standing liturgy, and it's another thing to make the principles of our faith a part of the rubric of our daily lives. A foundational belief for people of faith is God's love for us and our love for God. It's a belief that we share. We affirm God's creative power in our lives and in the majesty of the world. We are spellbound at the handiwork of God's creation and the fact that somehow, for some reason, we as human beings have been placed in the midst of it all. And in response to those amazing acts of grace, we in turn express our love for God. We gather in houses of worship to seek the presence of God and to reflect our love and devotion to God. It is what we believe. How we act is another part of the question. To make confession on a Sabbath day and then act in complete opposition to that confession calls into question the confession itself. Was it genuine? Did it mean anything? Our deep devotion to God in faith is most effectively witnessed in the way we in turn reflect God's love by loving our neighbor. Our faith says to us that what we have been given, we in turn must give. This concept of loving our neighbor is where, quite honestly, the rubber hits the road. One of the most significant ways that this practice of our faith has taken place has been in the midst of the COVID-19 pandemic. This virus, as we all know, has no borders whatsoever. And it has most significantly affected persons of color in disproportionate ways, revealing the reality of economic imbalance, inadequate health care, and poor living conditions. It has also most significantly affected people with pre-existing conditions and the elderly. Our responsibility is not to express our devotion to God, but reflect that devotion in the way we care for one another. It's a complete package. There is no doubt that the closure of some of our houses of worship have caused a tremendous burden on economic sustainability of our churches, especially our small membership churches in rural settings. But it's also created a void in the way in which we worship, fellowship, and support one another. But the drive for houses of worship to comply with the CDC and the New York State guidelines is really, from a religious standpoint, focused on how we connect the dots between our stated belief on one hand and our lived out faith on the other. We are most certainly in the business of caring for mind, soul, and body. The COVID-19 pandemic has most certainly caused a mental strain on us all as we have endured these long, unpredictable days. It's been a strain that's generated a longing within us for personal contact and a temptation to look for ways to get back to the way it used to be. But the pandemic has had a deeper effect. People have been ill in body. Hundreds of thousands of people have died. And in recent weeks, stories have multiplied regarding gatherings of people who do not exercise caution or wear masks or sanitize properly or maintain proper social distancing. No one is immune. People have been affected in the city, in the suburbs, and in the country. It affects us all. Our support for the governor of New York is solitary in its focus, in that New York State has phases, and the governor has made decisions that are reasonably based on science and in a context where houses of worship are treated in general no differently than any other place of assembly. I think it's true that houses of worship and worship gatherings are actually significantly more dangerous than other places of assembly, similar to indoor dining without a mask, especially given disproportionately affected and elderly populations. The proof that masks and quarantines worked, whatever the pros and cons are, is our current flatline death and infection rates. This while more than half the country, mostly in anti-masked states, is being crushed by a resurgence. And their downturned economies are now enduring a second blow that's far more damaging than our 8 weeks here in New York has ever been. We're moving forward here in New York, and most of the nation, as we know, is moving backwards. PPE and common science works. As judicatory and faith sector leaders, we are determined to spare our congregations, clients, and fellow New Yorkers from that same deadly and economic destructive fate. And the only thing that's worked to date anywhere in the world has been masks, social distancing, and good hygiene. While the temptation has been to say, because of our faith, God will take care of us, that belief has caused people to want the church to somehow be treated differently than the restaurant or the theater or any place else where people naturally want to gather. The pushback has centered not only on the desire for preferential treatment, but also on the argument of religious freedom based on our Constitution. The provision for religious freedom is a great privilege of our democracy. No one can suppress our freedom to worship. But while we have religious freedom to say that we will worship regardless of our circumstances, we also have the religious freedom to say that in spite of rulings giving people permission to worship with no restrictions, we will exercise the freedom to say no thank you. We choose to be active participants in solving a global problem that is no respecter of persons' conditions of faith. This is where our proclaimed faith can have the greatest impact in the way we live out the faith that we claim. Because of our faith, we will follow the guidelines. Because of our faith, we desire to take care of our people, especially those that are disproportionately affected, those with pre-existing conditions, and the elderly. Because of our faith, we choose to be smart, united, disciplined, loving, especially loving. Because when the road appears and the light is seen at the end of the tunnel, we should, as people of faith, be able to look back and say, we did what was right. We took care of our people. We loved God so much that we, in turn, did everything we could to love our neighbors. For us to have a holistic discussion today, though, we thought it would be important to get the perspective from the legal and the medical communities as well. Welcome, Dr. Varma. It's good to see you. And Mr. Cohen, thank you for taking the time to be with us. Dr. Varma, let's start with the medical perspective. From your vantage point, with what we know today, how is this virus being spread? We've heard that it's spread through the surface. We've heard that it's spread in the air. We've heard that it's spread through contact. What insights would you offer us today regarding how to prevent the spread, especially when we think about limiting reopening of our houses of worship?
I just want to start by really being thankful that you invited me to join here today. This is a challenging and confusing and difficult time, I think, for all of us, regardless of what our perspective is. And I think it's obviously particularly challenging for all of you because of the difficulty in practicing and worshiping the way you have wanted to do and continue to do, while at the same time, of course, being respectful of the dangers that any type of indoor activity presents. So the way I like to think about this problem and communicate it is to think about words that begin or sound with C. The highest risk places are anywhere that are contained or enclosed, anywhere that is crowded, where there are a lot of people, anywhere where that crowd of people is close together, anytime there is conversation or use of the voice.
We've lost you, Dr. Varma. There you go. You're connecting to audio. Can you hear us now?
Can you hear me? I'm shifting to my computer
audio
now. It looks like I got disconnected from the phone connection.
You're good. We can hear you.
Okay, good. Sorry, my room isn't great. So I was saying conversation or using your voice. The next is chronology, the amount of time you spend in the location. And the last one is contamination. Is there the possibility of environmental contamination? All of those risks are not equal, and anything we can do to reduce any of them can be beneficial. So if we think about being in a contained, enclosed space, it is possible to do activities in a contained space if it is very large and there's a lot of dilution of air. So you could imagine instead of 20 people being brought together in a small room, bringing 20 people together in, say, Madison Square Garden. So then even though you're technically indoors, your space is substantially different, and you can mimic some of the benefits of being outdoors. The same is about, crowding and being close together. Anything you can do to remove and amplify that space is beneficial. The challenge with the rule that we have, or that we follow about 6 feet, is that, again, if you're still sharing the same air, like in closed space, that 6 feet becomes less of an advantage to you. So that's where the issue also about wearing face coverings is really important. We have different types of face coverings, those that we use that are the regular cloth ones, which primarily reduce the risk that I will transmit to you. It doesn't stop the risk, it just reduces it. And then also, of course, the importance of thinking about how we reduce our conversation. And of course, this is a particular challenge for any type of house of worship where singing is a part of it.
Right.
Because of course that is part of the way people worship, or even chanting or any type of repetition. And again, this is the dilemma. Anytime we use our voice, we're at risk. I think the last point I would try to make is that contamination of surfaces is theoretically possible. We haven't seen a lot of outbreaks specifically from people touching surfaces. Doesn't mean that they don't occur. And that's why, hand washing and hand hygiene and reducing shared things is good for all disease prevention. And it's a reason we want to be careful about it, but we don't see that right now as the highest risk. The highest risk really is that close proximity where people are using their voices, and particularly in a closed space.
So really there is good sense in the 25% or 33% capacity limitations in confined spaces.
Increasing your occupancy to 1/4 can help you achieve that. That's really important. I think one sort of other mitigation strategy, what we consider a way to reduce risk, is to really emphasize to people a couple of things. First of all, do not come if you're feeling unwell at all. It just, there has to be a way, obviously, for people to worship, because, also if they're unwell, they may feel a need for that community and that fellowship. But that's really important. So if those, if you have 25% occupancy, try to make sure people are not unwell, give them reminders when they're in also about doing that. I think that's critically important to add.
So that really leads into another question, and that is, from your vantage point, as leaders of houses of worship, we welcome in people for worship. From your mind, what's the best way for an average person to prevent the spread? You mentioned it about folks that are not feeling well, but a person that wants to come to our church, what's the best way that they, as an average person who's coming into our church, how can they participate in preventing the spread?
Yeah, so I guess there's always two things. There's always, how do you protect yourself, so that you don't become infected, and how do you prevent the risk that you might transmit to others? I'll just mention that second piece for a moment, because one of the biggest challenges to this disease, and I've worked on infectious diseases all over the world. I just recently moved here back from Africa, where I was for the past 3 years. What changed in a lot of our minds was recognizing that this infection can be transmitted by people who don't have symptoms. They may get symptoms in the future, but they don't have them right now. And that people are actually very infectious in that stage. It's not just a low risk, it's a high risk. And that's what completely changed a lot of our thinking about the importance of face coverings. This hadn't been something that we thought was very important until we learned scientifically that oh my gosh, this virus is different than a lot of other viruses. So for the second issue of how do I protect those around me, my fellow worshipers, the most important thing is one, staying home if you're not well, but number two, wearing your face covering, and then of course trying to maintain distance. Now, the second challenge, which is how do I protect myself? And I think that, obviously the same thing applies. If access to and can find, because they're now more abundant, what we call medical face masks, and they look more like these right here that have a nose clip and can seal a little better, and they're pleats. They're a little bit more effective in terms of protecting me, not just me coughing on other people, but me receiving infection. So that's an added thing that you can buy. My wife just ordered another packet on Amazon. They're available on Amazon. That will help protect you. Number two is trying as much as possible to maintain that distance. Certainly hand washing, like I mentioned, is beneficial. It may not be the most important thing, but it is always beneficial. Limiting your physical contact with other people. And then I would say the final thing is, keeping some track of who you're in contact with. One of the reasons we worry about any type of indoor environment, like a house of worship or even like a restaurant, is that you may be in contact with people that you don't normally interact with in your regular life. And while that is incredibly beneficial from a community perspective, we want to bring people close together, it's a little bit more dangerous from an infection perspective, because you have the risk of transmitting outside of, if you just transmit it in your home, we can stop that from becoming an epidemic. But if you transmit it to people far outside your network, that can be risky.
Thank you very much.
Thank you, Dr. Varma. Peter Cook, New York State Council Churches, here with Peter Goditis from New York Interfaith Disaster Services. Is air conditioning a problem in different areas?
Yeah, no, it's an excellent question, and there isn't a perfect answer. I will explain the challenge of air conditioning. So, what we think right now, and again, we're open to things being changed, is that the risk related to air conditioning is more related to the sort of wind current that it generates. So if you can imagine that there's a window air conditioner or a freestanding air conditioner, not centralized, but a freestanding one, that's blowing air, let's say, from one side of the room to the other side of the room. People who are in that wind current are potentially at risk. So if I'm sitting on one side and the air conditioner is next to me blowing air, that could potentially carry the virus much further than 6 feet. We know there are situations where virus can even transmit further than that, even on its own. But this sort of adds to the potential risk. So that's like being downstream of a current. And that's one of the reasons why I kind of like natural ventilation, particularly air cross currents from one room to the other are beneficial because the airflow is kind of turbulent and it kind of like will disperse the virus as opposed to going in one direction. The challenge that people are really concerned about, and I think the root of the question is, does me, if I have an infection, does that virus go into the air conditioner or the central air conditioning system, then get spit out in another part of the room and therefore risk? We don't think that happens very often, if at all. I have not seen of an event that's been documented where that has occurred. It doesn't mean it isn't possible, but it does mean that it doesn't seem to be the primary route why people get infected. And that has to do with the virus. Most of the times when people are coughing or releasing the virus, it's smaller particles, so they don't float quite as much. So again, it may happen, but we don't think it is very likely.
And a follow-up question related to that is air purifying systems. I see these happen in doctors' offices.
Yeah, you know, again, we don't know for sure. My personal feeling is if you can afford them and you have them in there. So there are two different major types of air purifiers. There's the ones that are like freestanding ones that you can put somewhere. I lived in China for 3 years working on infectious diseases. We had a lot of these in our house, primarily because of pollution. And there are the ones that are centralized, what are called like in your HVAC system, your heating and ventilation system. We don't know the answer to that. My personal feeling is that if you can afford it and you have it, it certainly doesn't do any harm and it may provide benefit. But I wouldn't rely on that as your primary method. I think the methods that we've discussed, like face coverings and even potentially medical masks, maintaining distance, those are going to be much more reliable. But these other things may help. We just don't know how much.
Peter G., you have a question.
Thank you, Doctor. I'm just going to set you up with two questions. Hopefully we can get through these with relatively quick answers. We really appreciate your time, but there's quite a number of questions in the chat about concerns about singing and preaching and the projection of obviously virus in people's micro droplets and spittle. The other is about the sharing of ritual objects and the risk of like shofars and communion cups and these kinds of things. So if you could just touch on those two issues.
Yeah, singing and speaking are challenging questions. We know that any use of your voice, it assumes from the moment that you're infected and you can infect other people, any use of your voice is riskier. I mean, one of the things that you see in some of the East Asian countries, like in Singapore, is that they tell people you shouldn't speak on a subway car, for example. And so the challenge is, does singing or chanting or speaking at large volume produce more particles than just quiet speech? The answer is, in most situations, yes. The louder you're projecting your voice and the more forceful you're using it, you will create more virus. But there's a lot of individual variability. One person may produce very little even at that volume, and another person may produce a lot. So we give that as a broad recommendation that we prefer people not to sing loudly and things, but it's quite challenging. So that's why there's a very blanket recommendation to limit reduction, because we can't predict individual variability. And for the question about shared objects, again, this is the challenge. Like, we know that objects like a shared chalice where your mouth might touch it, or even objects that you might share with your hand, like a collection plate, we know they can be contaminated. And if you touch it with your hands and you have the infection, and then the next person touches it with their hands, and then they use their hands and then touch their face, that is a route in which infections get transmitted. We know that with the flu, we know that with other viruses. How often it happens, we just don't know. And so that's why our general principle, because this is a dangerous disease, is to say, avoid those as much as possible.
Just to clarify for our participants, it would be safe to say that wearing a mask and face shield for singing or preaching would be the safest way of doing those things if we insisted on those. And the second would be, if ritual objects are going to be passed from one another, they need to be sanitized, or separate, Dixie cups for, some kind of thing like that for the sharing of communion wine would be better than a common chalice.
Yeah, absolutely. And
Okay.
particularly, especially if you're not touching it with your mouth, you're just touching it with your hand. The other would be to have like hand sanitizer available so that everybody, before they touch it, literally almost right before they touch it, they clean their hands in some way.
Thank you.
So, Dr. Varma, it appears that really what you've been saying to us the last few minutes is that we should just be exercising extreme caution in all things. The more that we can do, the better off we are.
Yeah, absolutely. I mean, these are all added benefits. Unfortunately, we don't have a magical, solution for this solution. So these are all kind of behavioral type things, and each one adds benefit. And that's always, I think, a confusing aspect, for people, is the concept of, is it just this? And if I just don't do that, I'll be okay. And the challenging part is it's a lot of things together. And I think that's why all of you, you're leaders of your communities, and so we want you to not only help people practice in a way that reduces harm. Nothing can eliminate it right now, but reduces harm. But also communicating those messages so that people carry them through on their regular lives as well too.
We thank you so very much for your time. We know you have to get off for another call, but thank you for giving us these few minutes to give us some insight. We really greatly appreciate your perspective on these things. Thank you.
Great, and I am sorry that I have to jump off. If there are other questions that come up, maybe Reverend Hugh or somebody else can just send them to me by email, and I'd be happy to respond to them that way as well.
Fantastic. We appreciate your willingness to help us out.
No problem.
Thank you,
Dr. Varma.
Okay, bye-bye.
Mr. Cohen, thank you for being with us today. And you bring a very unique perspective from a legal standpoint that we thought it was important to get your insight and wisdom. So to get the conversation started from that angle, I would simply ask you, what are the potential legal liabilities that houses of worship face when they choose to reopen? Go ahead.
That's an interesting question. I think the broader question that results from the governor's executive order, and there's executive orders by the governor of California as well, that they're looking at it from a totally different perspective. And if I could say, Bishop Bickerton, after listening to you, I feel like a lawyer in a courtroom who's obliged to disagree with what I've heard before, but I'm so totally in sync with everything you say that I'm sorry to say, Rabbi, that I'm actually thinking about going over to the other team now.
Thank you very much. I'm very excited.
But
It costs you a lot more there, Joel.
I think one of the issues that arises from this whole problem, and I'll go in a slightly different direction if I may. I watched some of the memorial services for George Floyd, and it's relevant to the discussion I'm going to have right now. And there was one in Houston. In that one, there were probably 10, everybody in the room was black, with the exception of one preacher, one white preacher. All the other speakers were black preachers. They did an excellent job. The white preacher from Houston got up and he said, and he was in a little bit of an awkward situation. The racial tension in the country was at its worst at that moment. And he said, and I listened carefully, he said, anybody who says they believe that they love God and don't love their fellow man is a liar. It's an extraordinary statement. And he was saying how much we need to love our fellow man, and that's, Bishop, what you've been talking about. Unfortunately, sometimes, and I'm not a constitutional lawyer, lawyers do things that they must. And there are 2 pending lawsuits that I'm aware of in the United States, one in New York and one more recently in California. The one in New York was brought by 2 Catholic priests and some co-plaintiffs who were observant Jews from Brooklyn. And the lawsuit claimed that the governor's orders restricting or closing housing of worship at some houses of worship at some point violated the Constitution. And they drew on the fact that the governor of New York and the mayor, the lawsuit was against the mayor as well, Mayor de Blasio, that they seemed to be supportive, and they were, of the protests, which I believe are totally organic, and the police and the mayor and the governor couldn't have controlled even if they wanted to, was such that, well, you're allowing it to go on the streets where people are in such close proximity, but you're not allowing it to go on in churches, synagogues, and other houses of worship. The judge ultimately said that the situation in terms of churches, synagogues, houses of worship needs to be altered. They need to be in compliance with what's allowed for businesses and offices and the like. And the governor sort of had already brought down the temperature in terms of allowing this 25% rule or whatever is presently in existence. The interesting thing in California in the lawsuit, it's a recent lawsuit brought by 2 churches, is that the governor has not allowed singing or chanting in houses of worship. Obviously, based on what the doctor has just told us, the concern about the droplets flowing through the congregation. Now, the judge in California has turned down a temporary restraining order, restricted right away. But I'm sort of looking, maybe not as a lawyer, at the fact that what are the motives of the governor or the mayor or any other governmental leaders around the country or around the state? Their motives aren't bad. They're not trying to go after the churches or synagogue or mosques or the like. They're trying to protect the public. And it seems to me as a lawyer, although I don't practice constitutional law, the obligation of the law is to do something to deal with the problem that we have. Yeah, of course our religions talk about chanting and singing. It's in the Psalms and it's important for all religions, I suppose. But why those risks that we bring a lawsuit for that purpose in order to stop the restriction on chanting? I mean, isn't saving life the most important thing in every religion? I'm not speaking as a lawyer now, but maybe lawyers should speak about that as well. I hope judges speak about that as well. I mean, if we don't believe that there is this serious problem to our health that, I'm sorry, I'm not meaning to get political, that the president seems to have only recognized only recently, then what are we all about? So I don't know if I've answered your question, Bishop, but I'm hopeful I added to the conversation.
No, I think it's been a rich answer. To drill down to a local level, though, let's take a church in the Catskill-Hudson Mountains or a church out on Long Island. What should our local churches be aware of or sensitive to when we think about reopening our houses of worship from a legal standpoint?
I think what they should be sensitive to is if there is a restriction that is granted by the governor, say the governor says you're allowed to have 25% of occupancy, spread out with distancing and masks and washing and reporting and temperature checks, that I don't know that's a complete answer to it, but at least you're complying with the governor's guidance. That's a pretty good defense for the institution. You've complied with the governor's standards, and not only that, standards that have been tested in court, because there is a court order saying he needs to be in compliance with what the executive's orders are across the board for other institutions, whether it's a library or restaurants and businesses and the like.
How meaningful is it for a house of worship to maintain records of their disinfecting and cleaning on a weekly basis, so that if there's any questions raised, there's a trail that's
critical? All of that stuff to show that you've been testing before, that you asked people to take a temperature test, that you ask them in advance, that some synagogues, I know, I'm not as familiar with churches, are requiring you to let them know in advance whether you've come from, say, California or Florida or other states where there are infections. Have you been quarantined for the 14 days since you've been there? All of that stuff is extremely helpful to a religious institution in making a record. And frankly, that's what one must do nowadays in the face of potential litigation. But I think the most important thing is in compliance with the governor's executive order.
Mm-hmm. Great, thank you. Peter C., Peter G., what questions have come in?
There's one that's kind of a combo question. What is the potential liability, I'll just say house of worship, not just church, but to any house of worship, if they sponsor events that are held off-site, but the governor's restrictions are not followed? So there's still a church gathering, but just not on their campus. And combined with that question, it's in 2 parts, is what's the liability if they allow their space to be rented by other groups that do not follow those restrictions?
You're way out of my league with those questions, I'm afraid. I really don't know. I can't help. I'm a criminal lawyer, actually. I don't think I can be of help on those particular questions, much as I'd like to be.
Okay.
Peter G., I could weigh in simply saying that from the United Methodist standpoint, our reopening guidelines have been very clear in stating to our local congregations that if they rent the facility, we expect them to require the very same guideline compliance that we've asked of those congregations.
And you would shut them down if they didn't.
Exactly.
Yeah.
So that the consistency of it not only is, I think, important from a legal standpoint, but it's also important in terms of our public witness. What does it say if we are being inconsistent in the manner in which our facilities are being used?
Yeah, and I would also say regarding the first question, the governor's executive orders have restrictions for all gatherings. So whether it was on your campus or not, you would still have to apply, you'd still have to comply with the state's gathering restrictions. That's my legal opinion.
Well, we've been pretty clear with our people in just saying, please don't look for a loophole. Mr. Cohen, I really appreciated your remarks earlier. Please don't look for a loophole, because we're looking at people's lives here, and it's not about getting around things. It's about taking the intentional steps to move through things so that we can make sure that our people are well cared for.
Yeah, and Bishop, not meaning to pass the buck, of course, the rabbi is a lawyer, so maybe you're letting him off the hook a little bit. You might have a question.
Bishop, I did have a question for him as well. And I don't know if I heard this being asked, can a church be sued if a person, say, they contracted the virus at their house of worship?
Well, I think, needless to say, anybody can be sued, but I think part of the problem is how much you have a defense in terms of the things that we've been talking about. How much you've gone to make a record of exactly what the church has done to make sure to limit the possibility of it. Always in the case of negligence, it's important to have the record of what you have done. Did you repair your car when it looked like the gas pedal was working too hard? What have you done in anticipation of potential loss of health or life?
Would you say it would be pretty difficult to prove where they, even having those parameters, difficult to prove that they've actually contracted it at a house of worship, right?
For sure, it always becomes a factual issue, but one of the issues is the temperature testing. As you enter the church, might be helpful to at least show that you weren't bringing it there at that moment, so that the other congregants weren't bringing it and potentially infecting the congregant who also ultimately got infected.
And my last question is, can we legally mandate taking temperatures of everyone that walked through the door?
Well, whether you can legally mandate it or not, you could simply say you can't come in unless you're willing to do that.
Okay.
Yeah.
Okay. Thank you.
As is done on airlines, it's done in other places, yeah.
Right.
Just a follow-up question to all of this. Just could you restate how the governor is working with the court injunction that was issued in New York? And were there any modifications in his directives as a result of that? Or is he, how is he working with that?
As I understand it, as a practical matter, that lawsuit relates only to those particular plaintiff congregations. I don't think it applies across the board, although it would be persuasive to other congregations to comply with what the judge decided in that case. In other words, it might not apply to your church, it might not apply to Rabbi Potasnik's synagogue, but it is persuasive authority that you want to comply with a federal judge's instructions in another case.
Can I just add one thing about Joel Cohen, which he didn't say? Joel Cohen is a regular devotee of a congregation in Manhattan. He goes on I've seen his attendance record. It's pretty consistent. It's pretty consistent. And Joel will tell you, I believe, that as much as he loves God, as much as he loves going to services, as much as he loves listening to his rabbi, what he values more than anything else is the preservation of his health. And I think that has to be paramount. I think we all agree. We don't always agree on other things, but I think what brings us together here is a commitment to the protection and preservation of human health.
No
And I
question.
think that's a powerful word, Rabbi, and I really, really value that. I just think that we are stewards of what we've been given. And that's from a personal standpoint, but also from a corporate standpoint. So I really have appreciated over the months what the governor has said in his press conferences when he wears a mask and takes the mask off, and he says, you know, I wear a mask not just for me, I wear a mask for you. I want to keep myself healthy, but as a member of this global family, I want to make sure that I do everything I can to keep you healthy too. It's that kind of I think holistic thinking that's really valuable at this point, because like it or not, whether it be issues of race or issues of COVID-19, we are in a phase where people are thinking more about themselves personally than they are the other. And I think we as religious leaders have a deep responsibility to proclaim effectively the fact that we are in this together, as we should be if we desire a better world. Rabbi Potasnik, you've been pretty quiet in this conversation. What would you add to the conversation today?
You know, one of the things that I know is that in the Bible, in the Jewish Bible, and Joel, you would know this well, God says, I am your healer. I am your healer. Maimonides was one of the great physicians in Jewish tradition. Matter of fact, he was a physician to the Sultan of Egypt. And it was said the Sultan of Egypt maintained a very, very healthy regimen during that period. Maimonides said he's inspired by the words, I am the Lord your healer, because the ultimate form of healing is the prevention of sickness. So looking at the Bible, I would add, from a religious perspective, it is mandatory that we ask ourselves, have we done everything religiously possible to protect people when they seek to enter a house of worship? And if we can't answer that 100%, then we should not be opening those doors. So I am the Lord your healer. And then there's another statement, you have to guard your souls. You have to guard your souls, which again means you have to take every precautionary measure to see to it that you maintain your health as best you can. I think it's very clear, looking at all the evidence, listening to the doctor, listening to Joel and all of us, that we cannot safely say to our congregants, you're okay by coming in. You're okay. I think what we can say is, no, you're taking a risk when you come in. And why should we in any way put people in a risk situation when our tradition mandates that we don't do that? So we'll worship at home, we'll worship on Zoom, but wherever we worship, we'll do it safely.
That's a great word, and I really appreciate that. I mean, from a practical standpoint in United Methodism, we've been very compliant with the guidelines of only allowing our churches to open up 25% or 33% based on the region that they're in. But one of the things we've discovered is that we only have about 20% of our churches that have reopened, and of those that have reopened, they are not even at that 25 or 33% capacity. So I celebrate people who are getting it and living it out. Reverend Dr. English, you've got a perspective. What would you add? And then I'll go to Peter G.
Well, you know, for us as a house of worship, just because the door's open doesn't mean they're going to come, right? Because there are a lot of people who are saying, until we get past this, until we know that the curve has gone way down, as you know, it was reported today that in the US, we had more infections and deaths in the past 2 weeks than we did the entire month of June. So it has not leveled off. And so for us as men and women of faith, the question isn't, how soon can we reopen? It's like, how can we safely reopen? We really need to plan. The whole old statement is, fail to plan to fail, right? And so everyone is rushing into it, and it's to Joe's point, how do we get to that place where we know that when these doors are open, we are doing our optimal in assuring that our people are going to be safe? And so that's what we're really focusing on. We know there are a lot of churches and houses of worship that have closed as a result of not being able to open. There are a lot of houses of worship and leaders that are hurting economically as a result. But there's also this new wave of Zoom and internet and online interaction that we really do need to take advantage of. And for us, we're not looking to rush into it because, our Bible tells us wisdom is the principal thing. And a lot of people are falsely labeling it faith. This is, we have faith in God, so we're going to go in there, we're going to have our services. And if I die, I die. That's foolishness. So it's not just faith over fear, it's faith over fear and foolishness. And that's what we need to embrace. And really speaking that message it's erroneous. It's not truth. And I'm just going to say it straight out. That is not tied to faith. It's not tied to faith. And I think our scriptures are very, very clear on that. So my counsel is, just for those that are listening and watching, let's just take our time. Yes, religious liberties, but there is an intersection. What comes first, right? What comes first? It's about the safety of our congregation, period. Because we want to see them alive after tomorrow and the day after that.
Don't we though?
So for me, that's what's important. Just let's take our time, follow the guidelines, follow the science, and then we'll see that we'll have a successful entry.
Can I add one quick point? There's an interesting Jewish law. Yom Kippur.
We got to get to the questions in the chat.
Okay. Yom Kippur is the holiest day of the year. And the question is, what if the doctor tells you, even though you're commanded to fast, you have to eat? Jewish law says you listen to the doctor. And someone asks, suppose the doctor is an anti-Semite. The answer is you still listen to the doctor. Follow the doctor's prescription no matter what. So health rules overall.
We've got about 8 minutes left. Peter, you say there's other questions. Want to give you a chance to add some perspective as well if you'd like, but let's move to some questions.
So I just, there's a series of comments about how thermometers are kind of a false indicator because you can be an asymptomatic carrier. As a matter of fact, most people are asymptomatic carriers. So I think that those are some smart comments, and I think they're true. That doesn't mean that people shouldn't be checked with a thermometer because it's one method of screening, but we also have to be clear as leaders that just because we're checking thermometers and just because people are wearing face masks or practicing social distancing doesn't mean this is a zero risk environment. So we're trying, I think the way to put it is that we're all trying to take the safest possible steps. And that if you cross the threshold into a house of worship, you have to accept a certain amount of risk. That leads into another question that was being asked, which is, is it advisable in essence for congregations to ask people who attend worship to sign a liability waiver? I would say aesthetically, it's highly problematic. But at a level of liability, Mr. Cohen, does a church really indemnify itself in any way by asking people to sign waivers of liability if they attend worship or school or anything else?
I don't know that it is a foolproof mechanism. As you remember, the president's campaign wanted to have people do that in his program in Tulsa. Like you said, it's not aesthetically beautiful to do. It can't hurt, but it sounds to me like it's a very bad idea. from the purpose of what you people stand for.
Yeah.
It sounds like not a good idea.
But technically, would it offer any level of protection?
What the kind of level of protection it might offer is the kind of sort of an interim protection that people may not bring the lawsuit. Well, I signed the thing, so I've got no lawsuit. There's some value in that, I suppose. I just don't think it's a good idea, but it's not a field in which I claim any expertise.
Okay.
All right. Couple other follow-up questions. Some people sort of think this is an urban thing, and that if you're in a rural community or upstate, you don't really have to worry about this stuff all that much. And related to that is, given the recent rise in cases in states around us, should we plan to open our buildings or not?
Who's going to take that?
Well, Bishop Bickerton, I'd be curious to hear your answer to that question, particularly around the rural-urban thing, since you're in a diverse district.
Let me defer to Peter Gudaitis first. I'm curious about, Peter, your response to that.
Can you re-ask the question? I'm sorry, I was reading questions.
Sure. Some people that go around and they say, hey, this is just kind of a downstate urban thing. And, we're out here in this rural community in Western New York, and this doesn't really apply to us. And this is just a lot of overblown conversation. And, so
okay.
Just curious what you think.
I'd make two comments. One is, that's a risky falsehood. There was just a story yesterday coming out of Oregon that the second largest infection cluster in the state was at an extremely rural church in the mountains of Oregon, where 137 people got infected. And that was proven through test and trace, which I want to be very careful that we don't. There's a lot of sort of internet chatter about tracing is sort of a violation of your civil rights, and you can't really prove it because you can't really prove where people got sick. There's a reason why health departments use test and trace. It's because it's proven to work, and it's used when it comes to many different kinds of infection clusters, including food poisoning at festivals and church picnics and things like that. Never happens at a synagogue, only at churches, of course. But those kosher rules, they're an extra layer of protection. That's total falsehood. I'm lying. But I think that we should be very careful about the idea that rural communities cannot be infected by clusters. As I said, the Oregon example. But there were some questions that were asked before we got online this morning about some faith leaders in central New York reporting that numbers that had been flat there are now beginning to increase. Not in large numbers, but nevertheless increasing at the same time that New York City and Buffalo and other places that are urban are flatlining or decreasing. So it should concern us a lot. And the reason I would say is simply clear and true with pandemics in general. We live in a transient society where people fly all over the place all the time, and then they come home. And they can bring something horrible to a rural community just as easy as it can happen in an urban setting. It's just a higher risk environment because we live closer together. But look no farther than Japan. Japan is one of the most densely populated countries in the world, and Japan has had less than 1,000 deaths and has remained open economically as a society because of stringent social distancing practices. So we can see without major studies that societies around the world in many cities, including the northeastern United States, have had enormous success in flattening the curve and eliminating the virus And in states and communities where masking and other things have been fought off as a freedom violation are seeing just profoundly upsetting surges and increasing death rates.
And I would only add two other things to that very quickly. I think in New York State, our rural communities are very tempted by two things. One is the fact that in the phased reopenings, our rural communities have been opening sooner than our urban centers have been. And so the temptation to think that we've been into phase 4 for the last 2 weeks or 3 weeks, we're past this, we don't have to be as careful as we have been. So that acceleration of reopening is a temptation. The second is, I think from a media standpoint, it's just a given that the urban centers of New York are going to get the media coverage. And so it appears to be more urban in nature, when in fact it's just not. And I really value, Peter, your statement about the transmission piece, because the quarantines that the governor has instilled from people traveling into other states has been very difficult. I have a daughter and a grandson in North Carolina. If I go there, I'm going to be quarantined for 2 weeks. What a struggle. However, it is based on the reality of what you just said, and that is this transmission piece that as we travel, we're going to bring this in, and that happens in rural settings as well as urban settings as well. Friends, we are at the 12 o'clock hour, and I've gotten a message that Dr. Uma Mysarikar is on, the president of the Hindu Temple Society. Dr. Uma, would you agree to give us a final word today?
Good afternoon. I'm very pleased to join this wonderful panel, something that's so common to my heart and to what I do on a regular basis. As a president of the Hindu Temple Society of North America, which is the largest Hindu temple here in New York, we have several thousands of devotees who have been coming regularly. But we have followed the very strict rules, what Governor Cuomo has instilled from day number 1. And as of now, also, the temple is partially closed. We allow devotees, only 20 devotees at a time inside, but we observe all the precautions that have been instituted. And I personally strongly believe that as much as we're all religious and we believe in God and our faith is there, but we as humans must do first what we have to do, then God comes to help us. And therefore, I follow this very strictly, and our devotees have been very cooperative, and we allow 20 at a time at 6 feet distance. Everyone is, in fact, we have a little monitor which tells them, takes the temperature, and it tells them if they don't have a mask, wear a mask, it says. And then only they can get inside. And so I think it's important that all the houses of worship follow, and we don't know who comes from where, and we like to be as careful as we possibly can. To that extent, I'm very happy that devotees have been very, very, very cooperative, and I plan to do this until whatever the government decides to tell us.
Fantastic. That is a great word as we close this chapter of this conversation. As we close, I would just add a personal note of illustration. Over the last 3 or 4 months, I have only been in the New York area for the last 4 years. And the last several months, those persons that you see on this screen have come into relationship with one another as we've tried to jointly look at every perspective on how to deal with this COVID-19 pandemic. And I'm personally very grateful for the collaboration that's happened from the people that I'm looking at on this call. We are in this together. Yes, and that would be the word that I would say to all of you who are listening in. Please do not act in isolation. We are in this together. Yes. Churches, synagogues, and mosques in your communities, good leaders who are wanting the good for all of our people. This is a time for us to send out a public witness that we are united in the way in which we choose to care for the people that we love so deeply. So let's make a pledge today that we can join together in a continued fight to make sure that people understand that we really are about taking care of our people and keeping them as safe and healthy as possible. Thank you
We'll
for
all
taking,
collectively pray. Thank you.
thank you
We'll all
for taking,
collectively pray. Thank
Thank
you.
you. Thank you, everyone.
Thank you.
thank you for
Thank
taking
you,
the
Mr.
time to tune
Cohen.
in,
Thank you.
and we'll look forward to the next time we're
Thank
together.
you so much.
All right.
Thank you.
Bye-bye.
Thank you.
Thank you.
Thanks, everyone.
Thank you, Attorney Cohen.
Thank you.
Bye.